So are doctors now more educated? I mean, is there a sense? Because my understanding is that it's much harder to get these prescribed at this point.
All right, so let me give you my perspective. I have represented doctors for 20 years against the health insurance companies over reimbursement disputes. I have been to doctors' meetings from California to Maine to Florida, Arizona. There is no harder working, finer, higher minded group of people in our country than America's physicians. Do you realize that 3% of doctors are responsible for this overprescribing? The industry wants to point the finger at the doctors because it's an easy target. They want to point the finger at the addict because it's an easy target. Because we don't really have time as citizens to stop and think about it. You know, most people want to blame the addict first, the doctor second, the pharmacist third, and most of them don't even know what a distributor is. The person with the highest duty to be the policeman, to monitor where these opiates are going, were responsible for half a million murders over the last 17 years. It's a fact.
So the litigation is going in, and you're representing whom? Who are the clients?
Well, our clients are primarily cities, towns, and counties. And those definitions, townships or parishes. It's the local governments. Okay, it's not the federal government, and which, by the way, they're going to participate in this, as well they should. It's not the state governments and their attorneys general that are going to participate because they're Medicaid expenses. So many expenses, Sam, fall outside Medicare, outside Medicaid, on the communities who are already underfunded.
Let me just explain that part, because I don't know if that's obvious to people, but obviously, if you create an epidemic of opioid addiction, society, the federal government is going to pay for that via Medicaid or Medicare in providing services for those people, whatever subsequent services that they need, and the Medicaid comes in because the states administer that. That is the similarity, I guess, in terms of the tobacco litigation was
That's
that
right. That's exactly right.
Attorney Generals banded together, and it was because of the cost, the externalities that tobacco smoking and really the profit made from tobacco was imposing on state government.
The healthcare delivery system that the state had to fund. And in Florida in particular, Levin Papantonio was responsible largely for helping craft the law that said the state should be reimbursed for their Medicaid expenses. This is different. This is, a man is working at the factory. He blows out a disc. He gets put on OxyContin. He gets addicted. He loses his job because he can't get enough and he can't function. He loses his family. So he loses insurance. He loses his home. He's essentially homeless or traveling around or in a group of people. We've all seen it. It turns into a zombie land in many places in this country, West Virginia, Ohio in particular. There's zombie lands of addicts that have lost everything. And so while they are indigent, they don't have access to the healthcare facilities that normal people would, and therefore they fall outside Medicaid. So what happens is the county jails, the city jails become the emergency room for the addicts. And that's not paid for by any governmental entity. That is paid for by the resources of the cities, towns, and counties because they have to fund it.
Okay, and so they're your clients, and then, and I actually heard an interesting statistic, I think, from someone you're working with, who told me that if you look at the addiction rates, that the addiction rates are much higher amongst white people, and then African Americans are second, and Latinos are much less, and that's a function of an inverse proportion to the amount of medical care that was available to you.
Okay, so
am I explaining that correctly?
Well, here, let me do it this way. Let's go to a different angle. 4 out of 5 CDC statistics show that 4 out of 5 heroin addicts got started with a legitimate prescription drug. Now, you and I have been doing this a long time. The demographics know the prescription drug only comes if you can pay for it, which means you probably got insurance. So socio-demographically, that's sort of a given, right? And so, yes, the whites are far more subject to opioid overdose and death than the other.
Because they have more access to health insurance.
Correct.
It's just
That's
bizarre.
That's crazy, right?
It's crazy. Okay, and so, and then the other idea is that one of the things that I think my understanding is that you're working on is creating trustees, some type of trustee system, so that the money that is raised on behalf of your clients is expended in a nuanced way relative to the needs of any given community.
All right. So, again, let me remind you that I've represented doctors and their representatives for 20 years. This is an epidemic that needs proper treatment, proper recovery plans. That can only be prescribed by doctors. And so what the industry's done, if they've vilified the doctors who, by the way, many of the doctors who were responsible for over-prescribing had already been suspended. Their license had been suspended by the state boards. In other words, the doctors were held accountable. They lost their license. They lost their ability. They many of them went to jail. So the system protected the public from that. The problem is the industry circumvented that by giving access and the ability to prescribe to bad doctors. And so what the physician community is doing now, because they do believe that they are the ones that need to be prescribing medically assisted treatment for life. And do you do Suboxone for life? How does that work? How do you give these people the best chance to recover? And the thing that's most amazing to me is these doctors are on the ground all day, every day. They have patients dying in their arms. They know the nurses, they know the social workers, the people in the field that live in the sober houses. We're going through the network of physicians who are really committed to this, who've been vetted by the medical associations whom we know, who are honest brokers, and asking them, we don't want to reinvent the wheel. We don't want to take this money and create an infrastructure that doesn't exist. There are already great people out there doing great work. We want to access that. We want to tweak it. We want to fund it to the extent it needs to be funded, because that's really all they need. They have the heart. They have the effort. They have the talent. They just don't have the money, and that's what this lawsuit's about, giving them the money it takes to take care of these people.
So the awards that you're seeking on behalf of, let's say, a given county, some in part will go to maybe people carrying naloxone,
Suboxone, Narcan.
Or some may come to help treatment centers, but this is all, the idea is setting up almost like task forces that will assess what needs to happen there, because there's also an interesting dynamic insofar as that there's like it's like an equivalent to the baby boom. There is a cohort from a certain period of time, and you would know better than I when that was, where there was no awareness of this going on, and there was just like I think someone described it as a snake eating a Volkswagen, and it's just going to travel through the system, this big cohort of people who were prescribed from, I don't know when it
1990 to 2005, okay? That population of people who became addicted from 1990 to 2005 are in the snake, and there's nothing we can do to extract them. Two things need to happen. We need to, and some of it's happening. Controlling the prescriptions on the front end is important. The problem is that that will push, and we know this because in 2008, 2009, they made OxyContin incapable of being broken down, snorted, and melted so you could shoot it up. And so that pushed millions of people to heroin. So it doesn't end with the prescription.
Right.
So they stop the prescription. We know that it goes to heroin, then it goes to fentanyl. It's a continuum that is just, you can count on it the way the sun is going to come up tomorrow. Those people are going to be addicted. So this cohort from 1990 to 2005 are in the snake, The mortality statistics are going to continue to go up. We're only in the second or third year of that manifesting, because there's like a 10 to 15 year latency period before it really manifests in death. So prescription drugs, heroin, fentanyl, that's going to happen to those. And so the people since 2005 are the people that we want to address relative to real chances to help them recover, help them get to sober homes, get them medically assisted treatment for life, and those types of things that the doctors are really working hard to do. And then
so the idea is that you have different cohorts who have different specific types of needs, and they have to be addressed. So whatever awards you get have to be there has to be a system that is flexible enough and sensitive enough to be able to address the different sort of cohorts of people who have suffered from this, and the context is in which they're done in terms
That's
of
right, and it's on a continuum. 26% of the kids born in Cobble County, West Virginia, have an opiate addiction. 26% of the babies. Okay, that's something we can do something about for the next babies. But when a child, when a small child or a young person is affected by opium, what it does to their brain changes it forever, and you really can't correct it ever. They will remain with the best care possible, wealthy family, everything that you can give them. Rob Valek, our dear friend in the University of Colorado, says at best they got a 50-50 chance of not relapsing into drug addiction.
Wow.